I get the call and he says, well, it does come back as cancer, but that also means that your liver is cancer too. At that point, I just started crying. I was so upset because it escalated just like that. One phone call went from, yeah, we probably think you have a colon tumor, we can probably get rid of it, to you're probably going to die.
Hello, everyone, and welcome to Revitalize MD, RMD podcast with me, your host, Dr. Debra Durst. And so today I have a special guest with me, Renee Lor, and she is here in the studio with me. We are going to talk about our meeting, like our, journey together. Basically, we were brought together for certain reasons. We're going to go through that. But one of the main attractions and why we ended up in front of each other is because, I believe in non-traditional options for, all kinds of different, processes with the body and just regenerating and giving it back what it needs. And so that is how Renee ended up in our office, is because, again, of those non-traditional needs that are unmet by patients. So I'm going to let her say hello, and then we're going to talk about her journey and how we met.
Hey, thanks for having me. My name is Renee Lor, and I live locally here in the Knoxville area, and I'm just very excited to be here to share my story, and very grateful for Dr. Durst and her office and all of the resources that I've been able to have access to during my journey.
Yeah, and again, it is a very touching story. We're going to talk about it, but also just even the way we met and started to, talk and, just have conversations. So Renee was diagnosed, and I'm going to let her tell that story more, but diagnosed with cancer and wanted to do non-traditional, treatment options. And high dose vitamin C is one of them, and that's what we do at Revitalize MD. And so, in the process of getting treatments on a weekly basis, again, for a long time, we actually didn't talk directly. I was frequently in touch with staff, heard lots of stuff, was updated all the time. But like the office gets busy, I'm in and out of rooms. She's in the IV therapy lounge in the front. And so finally, one of my nurses, Erin, and I'll call Erin out because it was awesome because, again, she persists even if I'm busy, and she did that. And so she brought me into the room to talk with Renee. And that was during like a more difficult time that Renee was going through. And so it was great, and since then we've been talking, and that's what we're going to do today. Is, again, this is the first time she's talking about her journey, diagnosis of cancer, her view on that, how she ended up wanting to approach non-traditional options, and then, again, we've already talked about it, so in just hearing it, it's very inspiring for me and touching. And so I've been trying to get her on the podcast for a long time to talk about it. But it took a while. She had to feel like it was the right time for her. And so here we are. And so I'm going to just start asking some questions, and we'll just naturally have a conversation just like we do when we're in the IV room. Like just sitting in the room talking, because it's a nice lounge. It's kind of relaxing. And so we'll just sit there, and I'll pop in and say hello, and we'll start talking about different things. So again, I know that this is a very touching and personal journey, and it took you a lot to get on to the podcast to talk about it. So tell me a little bit about, again, like how this happened. Like basically how your diagnosis was given to you and the impact that that had at that moment on your life, because it's a huge impact for patients when they're given that diagnosis.
Yes, and the way I was given that will surprise you. So, back in like October 2022, I started having side pain, and I thought it was my gallbladder because my mom, she had her gallbladder out when she was like 23, and they say it's hereditary. So I was like, oh, it's probably my gallbladder, but it didn't go away. So I tried chiropractics, and chiropractics has worked for me before in different issues that I've had. But I went there for 2-3 weeks, and I still had that pain. And so I thought, okay, maybe there is something really going on. I don't have a general physician that I go to. I try to do things just healthy in general. So ended up calling a gastroenterologist, and I called them and they said, well, there's an 8-month wait. And I said, well, you can put me on the list if I'm still alive. I literally told them that. And then next week I was in the office. So talked to a gastroenterologist, and he mentioned, well, the cancer rate for people, I believe, like 25 to 35 is increasing for colon cancer. I'm not trying to alarm you, but you sound like you have signs and symptoms of that. And that blew my mind, because I had, at 33, would never have thought something like that.
Mm-hmm.
So they send me for all the tests, and they see that I have liver lesions, is what they call them. They did ultrasound, MRI, and they say, well, don't worry about it. Like, it doesn't look cancerous. There's no indication of that. So, we'll keep monitoring. So I had a colonoscopy and an endoscopy because I kept having this pain. And they come back and they find a colon tumor in my sigmoid region. But everything else looked good. The endoscopy was good. The rest of my colon looked good. I just had one cancerous tumor in my colon. But at the time, they have to biopsy it before they can say this is definitely cancer. So the doctor came in and was like, it's probably cancer, but we have to send it off, and then we'll come up with a plan after that. So, I thought about it, and we thought, okay, cancer tumor, probably can get it removed. You go on living your life. So they call me. I'm at work. I'm in a meeting with business folks, and I told them, like, I'm expecting a call from the doctor, just to probably say, yeah, we know this. And so I get the call, and he says, well, it does come back as cancer, but that also means that your liver is cancer too. And I'm like, what? You said it was benign. There's no issues. Well, because your colon feeds to your liver through the portal vein, that all of that is cancer now. And so it went from possibly just having that section out or whatever options they had to, you have stage 4 cancer with your liver full of cancer. And at that point, I just started crying. I was so upset because it escalated just like that. One phone call went from, yeah, we probably think you have a colon tumor, we can probably get rid of it, to you're probably going to die.
And all over the phone.
Yes. And so he didn't call me in. He didn't, request family or anything. It was just, this is what it is. And I just remember him saying, you'll be all right, Miss LaGore. Talk to you later, or something like that. So, like, okay. So after I try to compose myself, I'm in Knoxville, and so then I have to drive home. And I don't tell my husband on the phone, obviously, because it's not something you usually tell people on the phone. So I compose myself so I could drive home. And then I just walk in. I remember telling him, like, I just started crying and just told him, like, it's stage 4 cancer. My liver is cancer, and my colon has cancer too. And we just sat there and just cried and cried and cried, because obviously it's, again, you go from something that probably can be taken care of pretty easily from current medical practices to, this is a huge systemic issue. And it was really sad.
So, and I think even the impact of that alone, so if somebody is even given the diagnosis of cancer, that's huge. Just the word in and of itself has a lot of impacts and lots of things that go through your head. And what you're saying, again, because you had, I'm sure, even looked at and read into, and definitely knowing you, probably had a little even clue of what a tumor means in a colon in an isolated area that they're still getting past, that can be removed and resected. And even if that tumor maybe potentially had something systemic, you're still talking about the different options, but it has already spread and spread to a distant area, then again, that's the staging and the stage 4 that you're talking about. So that is changes the impact of just the word and the diagnosis to this is now like an end stage diagnosis of cancer and all over the phone. So,
Yeah. And that's again the just snap of a finger, click of a button, it went from stage 1 or 2 to you probably will die. So after that, we're very emotional, and the thing is, we don't try to make emotional decisions. So when you buy a house, you don't just buy it because you think it looks nice. You do some research and you try to understand, what do you want in a house? What do you have to have? What is nice to have? And I've always been taught growing up, make factual, rational decisions before, especially something big. And that was an opportunity for us to just stop and like think about this huge impact that came into our lives over one phone call.
yeah, over seconds of time and over the phone.
Yep. So that was something that we wanted to do, is think about it. They called after that phone call. It may have been like a day or two. They wanted to set up another doctor appointment and this and that, which we went to. But we wanted to think about what just happened. What does that mean? And we did. So then, we went to the follow-up and talked to the colorectal surgeon, and he really didn't talk about my liver, just talked about my colon tumor and the different options that were presented. And we wanted to get a second opinion because, again, we went from colon tumor to stage 4 cancer.
Correct.
So we went to MD Anderson, which is supposed to be the top cancer, one of the top cancer institutes in our country. And that's a whole nother story there. But they did do a liver biopsy. They sent that off and they did confirm that the liver was cancer. So not only now I'm in my head, I'm thinking, okay, initially I was misdiagnosed in a way because they said my liver wasn't cancer, but now we can confirm that it is cancer and it is stage 4. So that was another emotion to deal with, and just the fear of, well, what happened? What's wrong?
So when you go into, because again, that diagnosis was given over the phone, but then you're going into, because that's the GI doctor calling you back, right? And so he's scoping. And again, you have to get a tissue biopsy to get a tissue diagnosis if there's a cancer present, because you can think that there is or suspect, like they did when they were doing the colonoscopy, but then confirming with tissue diagnosis is what happened. So then you're seeing the colorectal surgery or surgeon, because they're the ones that are going to address taking it out. And then, was there a hemonc doctor too that came into the picture, a hematology, oncology, or cancer doctor is what I'm asking. Was that something that you saw before MD Anderson, and what kind of recommendations did they give you based on even, I guess, a presumptive liver, cancer and Mets at that time? So were they
Right.
recommending something in particular? And then, because I know those weeks right after the diagnosis, as we talked about, is like, they're huge because your head spinning, the emotions are all over the place because there's just so much that goes into just that word. And then you're presented with lots of different treatment options and urgency of those options, right?
Yeah, so at the colorectal surgeon office appointment, we asked a bunch of questions because by this time we were able to research and understand, what does colon cancer mean? What does a tumor mean? How does it spread? And I love doing research. It's always been something fun to me. I like reading educational
Learning. Yeah.
books. It's just me. That's just who I am, and I always have been. So I didn't mind to do the research and truly understand what this means. So we went in very educated with questions of what are our options. And the colorectal surgeon was not very, I think he was surprised. He was surprised that we knew more than we maybe a typical cancer patient would know, because we came home and did research versus, okay, I'm depending on this person to save my life, which is, understandable. But I also want to be responsible for that as well and ask the questions, because there could be some options that I can take that are specific for me. And so to me, that was important to do the research. But he was surprised with some of the questions that we were asking. And they told at UT, they told me that I would have to do chemotherapy first. We'll get a port in you next week. And we'll start the chemotherapy. If the tumor shrinks, that's great. And then we can go in and still take your whole sigmoid region out. So I'd ask the question, well, if it's going to shrink, well, then why, if we're going to do the surgery, why do we have to get it to shrink? Or vice versa? And well, that's the protocol as we have to do. Well, is my case different and this and that? So asked a lot of questions, and that still was the answer. We'll set up an appointment for you next week. You'll get a port in. We'll start chemo. Got to go at it strong and try to get that tumor smaller so we can take it out. Nothing was mentioned about my liver because he's a colorectal surgeon. UT didn't set up anything with a liver doctor or anything like that. And so to me, it's funny now, but not at the time. I talked to other people who were diagnosed with cancer, and they're like, never ask how long do you have to live? Like, never ask that. So me being me, I'm like, well, how long do I got, doc? It's kind of what you see on TV. And he's like, well, I don't think you have more than a year. And so he left the room, and I told my husband, I'm like, hey, that's not too bad. Like, we have time to research this. And so, like, we're still very emotional, still trying to be very, just still being grateful for everything, like the opportunity to be able to research. So he gave me about a year to live back in, I guess, that would be at the end of January 2023. But again, they didn't know my liver situation. So that's when we decided to really get a whole picture. We knew that there are other opportunities for treating cancer in this country, not just chemotherapy. There's immunotherapy. There's different types of things that are approved at larger facilities. And or even a clinical trial. Some people have success with that. So MD Anderson is probably one of those places that have a lot of those options. And we wanted to go there to make sure we understood what cards we were dealt with and how to play them.
And explore all the different options so that you weren't offered any of those other more progressive options at the local hospital.
No.
Was that UT here? Because I know UT is like our biggest, academic center here, but that was UT that you were seeing. Okay.
Yeah, UT Medical Center.
Okay. So, I mean, we have like an academic center to some degree, like they don't have a full-on residency, and it's not, like a big university that has every single residency, but it is a university and a medical center here. And so then I think that tertiary care center like MD Anderson, so you go there and now you're meeting with a oncologist, right? I'm sure. And so what happened then?
Yeah, so that was that was a long trip because at this point, before the actual diagnosis, I was already in a lot of pain. I couldn't breathe more than 50%. I'd take a half breath and it would start hurting so bad. So I'm still like recovering from like being sick. Like cancer is more of a symptom too. So this is a symptom. It's telling me like my body needs help and I'm hurting. And so we go to MD Anderson, we drive out there and we're out there for a week. We had everything set up where you see the oncologist, saw the liver doctor, saw the colorectal surgeon, confirmed, CT scan again. did a lot of blood work out there. And one of the options for their blood work is called liquid biopsy. And it helps you understand, like, kind of like maybe like the DNA type part of your cancer or how that's floating around. I'm not completely sure, but I know that the doctors are able to use it to help indicate which medicines would also be helpful too. But we went out there, and the UT was to transfer my records out there. They had my physical biopsy from my colon that they were supposed to ship out there. Come to find out, they didn't receive any of my records. So it was almost going or starting from scratch. And I just remember talking, they have a nurse practitioner or a PA come in to talk to you first, and then they have an oncologist that comes in next. And they already kind of had a plan for me, even though they hadn't seen any of my scans. I hadn't had my CT to them yet. They saw some blood work. But they already had a plan, and I don't know if that's because a standard protocol for stage 4 cancer, colon to liver, is these 3 drugs with this bioinhibitor at this rate. Like, I don't know that, but I think that's how that works, where there's a certain protocol that we would give to a patient for a specific diagnosis.
Certain standard protocol.
Okay. Yeah. So I think they had that set out, and that was disappointing too, because I see myself as an individual, as everyone should see themselves as an individual. Everyone is different. We're made differently. So why is there one protocol for every single person? But at the end of that whole ordeal at MD Anderson, talking to all the different doctors, getting that liver biopsy, which we come to find out is very dangerous because it can spread your cancer. You can get bloodborne illnesses from that too, but praise God I didn't. So anyways, their ending recommendation for my treatment was to do the strongest dose of chemotherapy possible, that they said this would kill someone older, but because I'm younger, I can handle it. 3 chemotherapy drugs, 1 bioinhibitor. Do that for 2 or 3 months. See if my tumors are shrinking. If they're shrinking, great. Maybe continue chemo. Eventually, they would take the left side of my liver out. So kind of to back up, MD Anderson confirmed that I had 5 liver spots or liver cancer regions. So 1 on my left, and then the rest on my right, with there's like this one huge one and then smaller ones.
And a total of 5?
Yes.
Okay.
Yep. So I had 5. So that's what we're working at, trying to reduce. But the idea is, well, we'll take the left part out, and then sew you back up, let that regenerate, and then do more chemotherapy. And then make a big L, slice me down the middle, take my xiphoid process out, take my gallbladder out, and then take the whole right side of my liver out. And basically live with the left side of my liver that I hope regenerated appropriately. And then sew me back up and continue chemotherapy. And then if I'm doing good enough, then we can take the colon tumor out. So take my whole sigmoid region out, and then sew me back up. Do more chemotherapy, because at this point we should have all of the cancer tumors out, and then I should be good to go. And I asked the doctor, again, because we came in with a bunch of questions. We had talked to people. We've read so much stuff on the internet. Not that everything on the internet is true, but it also helps you think. Like, it just gets you thinking, well, maybe this could happen, or maybe you could do this. So asked the oncologist, okay, let's just say I survive taking part of my liver out. It regenerates how we want it to. I continue chemotherapy. I'm still alive and walking and doing okay.
And able to, despite the pain and surgeries, yes.
Yeah, and most likely being bedbound, and then we do this huge L shape and take half of my organs out and then take my colon out. Like, what if this all goes right and all goes well and like we get all the cancer out? How long do you expect me to live after that? And he was very reluctant to answer the question. And actually, we were kind of dumbfounded what happened. He went to Google and typed in like whatever study from the NIH that they reference. He goes to Google, types it in, he scrolls down to find the answer that I'm asking and says, you probably have, after all of this, you probably have about 2 years to live if it doesn't come back, and there's a 60% chance it's coming back.
Or you don't get infections during some of the surgery, or you don't get pneumonia or sepsis from your bedridden state, all of the other things. And not to mention, like, as you're talking about this, because just working on ER and also having a family member, that had cancer, and I have a very touching story at some point that we'll talk and I'll share about that, asking how much time. But anyhow, the pain, like, so you usually are diagnosed because you're having a symptom of some sort, like you said. And so you start to have pain, and that's because it's reached such a size that now it's causing pain of some sort, no matter where it is. And the pain that you were having was not from the colon aspect, but instead from the liver, which is actually very important because that's one of the reasons why colon cancers need screening, because they don't often cause that pain until late in the game. So you're already having pain, not feeling well, now comes a diagnosis, multiple doctor trips with the thought of being cut and receiving chemotherapy, which we know makes everyone nauseated and sick as can be. And you're already not feeling great because we're thinking that this is you right now, just walking in, getting a diagnosis and thinking clearly, not with all that emotional, turmoil as well. But instead, you weren't even feeling well. And now the thought of all of this just compounded to that. And then, yeah, so I don't think I've never really seen a hematologist, oncologist give a good, basically realistic outcome prognosis, because I saw that in the ER all the time. Somebody that was like nearly on their deathbed by everybody's perception, but the family's still hearing that the scans are looking better. Yet we're at a point where we need to literally intervene and put them on a breathing machine, or they're going to die right there in the ER, but they don't know that death is imminent. But it's pretty obvious to everyone that's looking at that patient. So my point is, I said, if they told you, so even if we did, put them on a ventilator right now, did they tell you? What the outcome would be after all the chemotherapy if we pushed on, because sometimes it's having that realistic conversation because no one else has. And so basically you're asking them questions that most people don't ask. And I would say not all, obviously, there's the exception, but the rule is they probably don't get asked specifically enough.
Yes, and I think he was very surprised, and to the point where he had to go onto Google and type this in search and give me an answer, because he wanted to give me an answer, which I appreciate. But one of the other things that while I was there, we were able to do that liver biopsy, and they did have a clinical trial going on. And what that clinical trial was is they would take the tissue from your liver and they would cultivate it and put them in petri dishes, and they would actually put the different chemotherapy drugs to that liver biopsy or that tissue to see how they would react to that specific chemotherapy drug. So we're kind of excited to hear that, because if this chemotherapy drug didn't, maybe 15% had an impact, well, we probably wouldn't want to choose that. But this one had a 98% opportunity for killing the cancer cells. Maybe that's an option, and that's what we looked forward to, going to a bigger institute that had some of those clinical trial opportunities that some of the other local places did not have. But what I do remember is that was going to take 2 or 3 weeks, because it does take time to cultivate those. and put those different drugs to it. And the oncologist said, well, it's a clinical trial, so we're not going to dictate our treatment based off the results of this. And I'm like, well, if we know this is not going to work, why would we do it? Well, this is a standard protocol that we need to follow, which is going to be those 3 high dose chemo drugs with a bioinhibitor and see how you do. And that the confidence level in the facility dropped drastically because we are supposedly going to use something that is more factual based to dictate treatment, but we're not. So that also really hurt because I felt like we had a possible opportunity to have a positive outcome with chemotherapy, but that option wasn't going to be offered to me, even though we may know the answer.
So you had hope, that it would be more customized, and it wasn't going to be customized.
Yes.
And so, and I would almost, venture to say that also clinical trials or studies, and maybe clinical trials are different because studies are usually doing some kind of randomized controlled. And so you would think they would want to compare your standard treatment with this new. So it could be that because it's a trial, it's not necessarily a study randomizing, different treatment arms and potential outcomes. But I do think that prognosis is a huge point, and we hadn't discussed that before, is that asking what the prognosis is in the potential prognosis, because again, it could be different in somebody young and somebody older, somebody healthy, somebody not healthy, chemo versus radiation or surgery with the combination. But what is the outcome? So if I undergo everything you want me to, and I'm sick as a dog and I can't walk and I'm throwing up all the time, my quality of life is poor, what is my prognosis? And honestly, I mean, again, I saw it so often in the ER, which is why I bring it up. They don't give you a prognosis. And like literally families all the time would come in thinking things are getting better when you clearly can see the person getting worse in front of you, and not at all realistic about the outcome of that. And so I think that that's a huge point, because you were asking, what I think everyone should ask. What is the outcome?
Yes.
Like, what is the potential outcome? Like, because if they gave you 80% recovery versus 15 and you have a year still, despite everything you do, like what? But I don't think they really know, which is probably why.
It's fair.
Yeah, they don't do it.
And we did ask the liver doctor too, because, I'd asked the prognosis question here at UT, but I hadn't talked to a liver doctor. And I asked him, what is my prognosis? Well, and they said, I've seen tumors like yours that are already 40 to 50%. So that's what they had said. Yeah, my liver was 40 to 50% cancer at this point in March 2023. So I asked, well, how long do you think I really have with how bad my liver is? And he said, probably no more than 2 months.
Yeah, and so I think that it's also very interesting that they were going after the liver, because to me, that's a metastasis. So that is a primary tumor from somewhere else, and yours was the sigmoid colon that is now spread to the liver. And we didn't often chase the Mets first. That almost meant you meant a global, like that's where we're talking chemotherapy. Chemotherapy is treating it systemically, but you would almost go after the primary tumor first, remove, and then, pursue with chemotherapy after, if it was spread. And so it surprises me that there was a lot of talk on liver excision and chemo and not the sigmoid.
Right. And that, so I agree with that. And that's what also made us wonder, if we take all this part of the liver out and I still have my colon tumor that's feeding through the portal vein, this is what they're explaining to me, then why won't I develop another liver cancer or go somewhere else? I mean, it doesn't just have to go to the liver, it could go to the lung, the breast, like whatever other organs are there. Why not? Why won't it go there? So yeah. I can see what you're talking about, like that it doesn't make sense. And we asked that about, well, wouldn't you want to remove the colon tumor first? That's supposedly feeding all of this, and that was not their standard protocol. And but I think also there's a different aspect that I haven't mentioned yet is when I originally got diagnosed, I had this intuition feeling like do not do chemo. And so I get this intuition feeling, but then we don't know what that means. What does that mean? But we went ahead and pursued going to MD Anderson, understanding everything, understanding our options. But then in the back of my head, I've God was telling me not to do chemo.
So, and you talked about that strong intuition, like where suddenly it was, again, a sign and a message to you to not pursue chemotherapy. And so that came to you during like that time frame of Indy Anderson, but definitely during the time frame of still, exploring options, but not yet committing to any treatment. And so you had kind of made the decision not to. You guys both made the decision together
Yeah.
to
So
not.
we so it's hard to say because we didn't necessarily make a decision more than we were told something through our intuition. So it just kept in the back of my head. And, kind of looking back now, it all makes sense. And we can go through that, but it all made sense why that intuition ended up being right. First of all, I'm sitting here today.
Correct. And yeah, no. And your first diagnosis was when again? In 2022. The
Yeah,
hey,
yes.
okay. And so I think that like that's part of the conversations we've had so frequently is like your spiritual journey with it and just how strong that's been and how that's led to you looking into other options. And so tell us a little bit about that.
Yeah, so we go to MD Anderson. So now I feel like we have all of the information from a medical perspective. We've went to the local doctors. We went to a large cancer institute that has those clinical trials, the studies, and supposedly experts in how to deal with this type of diagnosis. They see, I'm sure, thousands of people, weekly. So I feel like we have all the information. But like I mentioned before, something in me just said, don't do chemo. And so you kind of stop and say, well, what does that mean? So while we're researching all of the information on how the colon works, how it feeds the liver, how this, all of this, we're also looking at different countries, like how do they treat cancer, or how did they just really, like as a whole body, is what really we found. And I don't want to use the word treat. I like to use the word like therapy. What is therapeutic for your body? But one day, I don't remember where we were. We somehow we were in town. I think we stopped at your office to try to understand what IV options that you had. There's a health shop right next door that has a bunch of different options. So those things started falling into our life basically. And one day we just said, hey, let's go to McKay's, which is a local bookstore here. It's huge. It's 2 stories. It's amazing. But let's go to McKay's and just see what they have. Because again, this is early, probably February, March. So before we go to MD Anderson, this is also happening, but we're still pursuing like understanding the medical options.
And at this point, you really had not done anything specific,
No.
not even changed up like lifestyle.
Oh yes, I
Okay.
have changed that. Yeah. So
So maybe talk about that a little bit because that's huge
yes.
and what feeds cancers, what they don't tell you, and also that lifestyle part of it that made a huge difference because you're talking about a significant period of time. They gave you a couple months,
Hmm.
and during that, you'd made some significant changes, which included
Yes.
lifestyle changes.
Yes, and that's huge. So we'll even backtrack even further from when I was initially being diagnosed here in the Knoxville area. I started writing down like what I was eating and seeing what maybe triggered the pain in my liver. And I found for me was corn. So I started to stay away from corn. I didn't have as many problems, but I still had a lot of pain. So being able to watch or do an elimination diet, I was able to do at least to help in the meantime. Um, and my husband's a dietitian, so that's the other ironic thing of this whole situation is my husband's a dietitian, so he knows the importance of nutrition and food and exercise and all this stuff. And so we still get I get this diagnosis of stage 4 cancer. I cooked meals at home already. Like, we didn't eat fast food all the time. We didn't go out to restaurants all the time. We exercise. We used to go to the gym. So it was very confusing to be diagnosed with that. So I'm also internally dealing with this. Like, I thought I was doing everything healthy and this and that. And as the changes that we made immediately, we looked at the food again and said, okay, what food causes specifically or feeds cancer? And we found sugar and glutamates are very feeders. They're feeders of the cancer. So that was the first thing I cut out. And now you're going to say, well, I don't think I could give up my brownies or my cookies and stuff like that because I love sweets. Like, I've always loved sweets as even a little girl. And if you think you can't give it up, if you pray and ask to be led away from temptation, you will, because the next day, did not crave the sugars, the artificial sugars, nothing like that, because I realized that it was my life on the line if I decided to eat this, because it's not just eating this, it's this leads to this, leads to this, and then we're back into the same thing. So if you know something causes damage to something, why would you do it? So I was able to stay away from sugar, and just, again, completely transform from regular conventional vegetables to, say, organic vegetables, and reading about Gerson therapy in different countries. So juicing, cooking like a soup that's just like all organic with bone broth, and why is that important? So it's not just me saying, okay, tell me what to do. It's okay, you're recommending this, and then why. So I'm reading all of this and trying to understand Budwig protocol. You mix like a kefir or I think it's like a cottage cheese type mixture. This is something from Germany.
And what is the name of the protocol?
Budwig protocol.
Okay.
And you mix this mixture and you drink in it, and it helps with like just helping get rid of cancer, but it's more, I think, more immune boosting. And that's the approach that we took. We want to boost my immune system because I felt as if my body could heal itself. And we had a spiritual experience with that. But if we fertilize the grass and fertilize the grass and fertilize the grass, the weeds will eventually dissipate because you're strong. Instead of torching the grass or just killing it all and just really hoping that your grass grows back without weeds, is kind of how we see it with the chemotherapy radiation versus trying to do it from a holistic perspective. Holistic meaning whole body experience, from your mind all the way to your exercising, and the food that you put in your body.
So I think that statement, and I've heard you say that before, and I love that. Like, again, that could be perspective and something that somebody needs to hear, just that fertilizing versus, again, killing and hoping it grows back. And then, like, sugars, again, that is not something that people are aware, but you've also said to me, again, at the office, that it was easy, not easy, nothing about what you've done is easy, but like, you taking a bite of the brownie, you would just think that is going to kill me.
Yes.
And it was like that, cut and dry, about at least what it would do, the why.
Yes, and that's specific for me, but
Yeah.
others out there may have some other type of condition that would also affect them. Even a lactose intolerance, like I'm not going to eat the ice cream because I know the outcome that I will have.
Mm-hmm.
Well, just a little bit won't hurt. Well, maybe it will, maybe it won't, but it's still my choice. And
Yes.
so that was something that I chose to avoid, even though I did talk to a dietitian at UT who told me, you can eat whatever you want because you're going to be going through chemotherapy, you're going to be sick, and you're not going to have enough calories. So we want you to just eat what you can to keep body weight on. So it's just a completely different perspective to have when you're going to do something that is non-traditional, and just try to gather all of that information and do what's right and what you feel is right, because
Mm-hmm.
ultimately I have to live with the decision. Like, this is something that, well, obviously, like, my husband and my family will have to live with, but this is me, this is my life, and I want to hear what other people have to say, their recommendations, but ultimately I'm in control of my life. I have to take responsibility for my life, and that's what we wanted to be educated in doing.
So, how did that mindset, how was that interaction with family? When family, because obviously traditional medicine, traditional routes, and anything that steps outside of the line is kind of shamed and guilted back into, the usual path.
Hmm.
And so, if they're hearing, this is what you need, this is how long you have it, and this is the only way to live or survive it, and then you're approaching it from a way that most would not, because again, it's your choice, it's your body, like you have made educated decisions on it. But how has the family interactions been with that? Because we've talked about this a little bit, and it's a perspective that I would not have thought about either.
And that's true, like the whole shame guilt, that happened, and even my dad was like, well, you have to do chemotherapy, that's the only treatment. And I just tell him, I understand what you're telling me, and like I appreciate what you tell me, but we're going to do more research to try to understand maybe what other countries do. Like, first of all, how bad is this? It did My cancer didn't happen overnight, so I don't I personally did not feel I would die overnight, but that's something that I felt. So I had time to make those decisions. His family also, well, that's the only option. His family also are doctors, and they're in the medical field, and that's what they know.
Mm-hmm.
And I understand their perspective in the sense of, like, that's what they were taught, and they've not seen any other options work for people that they've come across. But again, like, this is something I have to live with, and my husband has to live with. And so if we both felt that in our heart chemotherapy was not the right way to go, then I don't want to do something that I truly don't feel is right. I don't want to be pressured by other people, guilted, shamed. The fear was unbelievable from the doctors. Well, don't you want to live? You have to do this. Well, of course I want to live. I wouldn't be here asking you questions if I didn't care about my life. So I think the fear was trying to be instilled in me, and it
Mm-hmm.
is the C word. People don't even want to say the word cancer. It's a
Mm-hmm.
scary word. It is a scary word, but it's not as scary when you know that there's options or opportunities that are out there, that you can beat it, or you can win, or you can, however we want to phrase it these
Yeah.
days.
Yeah.
So um, the way I took it was, this is me, this is my life. And I say me, but my husband, because we're one through God. This is my life, and I have to do what I think is right, what we think is right, and
Mm-hmm.
what's going to be the best option. Because if it is go home and live your best life for 2 years, a year, that's your choice. If you
Mm-hmm.
want to go and do chemotherapy and hope that you do recover eventually in 5 years, you are living a semi normal life, that's your choice. So
Yeah.
this ultimately was my choice, and just respectfully trying to help family and friends understand that. And I think they were scared too.
Yeah.
I understand that as well. Like, oh, well, you have to do this. There's no other option. Well, we're going to see if there's another option.
So, and I think that that's an empowering decision, and also a pretty peaceful one. Like, you're not doing chemo, and you're not going to do that traditional, like, again, it's a toxin that we're putting in our body to kill certain cells, but it kills our cells too, and you are choosing not to do that. So it's empowering that you're not going back to that decision, like you're past that, but also just empowering to say, now I'm going to figure out what it is I am doing, and not like projecting that on to anyone else with cancer, but instead, the most important thing you've said all along is it is a decision you have to live with. So it has to be right for you. And I think that across the board is like we have one body, and we have to do what we feel is right for ourselves. Again, significant other, family members to some degree, if that, you guys have made this decision together. But it may be that if somebody was making a decision solely, that the other person needs to support them because it's still their body and their choice. And this has happened in more recent times. I still believe that all the way around. There is still freedom to choose what's right for you and your one body. And so, what were those other things that you were doing? Because we started to talk about it, like nutrition is huge. And so, the sugars, different protocols. And then you started exploring some other, and you found a book that might have led you to, if you want to tell us a little bit about the book, because I know that was huge. Like, you guys ended up at McKay's
Hmm.
looking through books, and then you find this book that really resonated with you.
Right. So, kind of like layering all of the timeline here. So, back in February, March, I think I started to mention about going to McKay's, huge bookstore here in the Knoxville area. And we just randomly go to the alternate therapy section in McKay's and find this book. It's called The Cancer Killers. The Cause is the Cure. And it's very small. So you can see it's a quick read. And it was really the basis of our research. So they mention a lot of different things in there. And so we would read that and not necessarily use that as a source of truth, but we would take that and then go on the internet and do a bunch of reading, different, even NIH studies talking about some of these different options that they have in there.
Mm.
So taking the information from this book and just going forward and reading more. And some of those things are the IV vitamin C. They do that in different countries. Ozone therapy, infrared saunas, lymphatic massages in general, coffee enemas, chiropractic. Like, there's so many different things that are out there. And I could probably go on for 20 minutes in just explaining all of those different therapies. But again, like, I had to choose what I felt that was right for me and my situation. And what we could afford, and what we had time to do, what was right for us. So, using that. So, not only did they talk about therapies, they talk about like what I'll call intake. So, maybe extra supplements, different foods. Water is so important. We drink from plastic bottles all the time. I'm sure everyone has seen about the microplastics in the water bottles. Like, that's true. So, how are
Mm.
you making a difference in that for your body? Because ultimately, again, it's your choice. So,
Mhm.
my husband was able to install a reverse osmosis system in our house, and that's the water that we drink. We drink from like glass or stainless steel whenever possible. Um, so water is very important. You got to think how much of your body is water, and so
70%, right? Yeah. So, yeah.
so if you have good water, clean, filtered water, then that gives your body that chance to start healing itself.
Mm.
So not just like the reverse osmosis, even we bought like a filter, like I'm not sure how you call it, but just one of those standing filter HEPA filters. Just
Mm-hmm.
run it through the house. I mean, there's a lot of toxins in the environment naturally, whether it's mold or, pet dander or whatever. It still can impact your life. So, I I always go back to like a pyramid. Like there's like the most pristine thing that you could do is at the top, but like what really makes sense for you. So some of the things that made sense for us is we could do a reverse osmosis system, and drink that. We could buy something small. And I know some people even get one for their whole house. That wasn't feasible for us at the time. And we still don't have one. I still would like one, but that's something that someone could do at that top of the pyramid. Maybe some of the other things as simple as lotions and shampoos, like starting to think about what are in those. Your skin absorbs all of that stuff. So I had to rethink every aspect of my life. Cooking, mentioned that I love to do cooking.
Mm-hmm.
No more Teflon. I grew up kind of learning how to cook on Teflon. So had to relearn how to cook in a way with stainless steel or cast iron, and different means of doing that. But it truly was a whole body transition from your head, your shampoo, down to what you brush your teeth with, the water that you used to drink, to even your clothes. I think the Bible says you're supposed to wear like cotton, wool, and linen or something. And there's probably a reason for your body to breathe. Your skin is trying to get rid of toxins, and so my approach was, I need to detoxify myself, and
Mm-hmm.
not one of those, let me go to the internet and how do you do liver detox? Like this
Deep,
is
deep detoxing.
yes, this is life
Life
changing.
detoxing. Yeah.
And I knew going into this wasn't something that I could do for, maybe let's do it for 2 years and then I'll go back to using the traditional shampoo or soap or, drinking unfiltered water.
Mm-hmm.
This is something that I'm going to have to do for a lifetime. And looking back at the time, it's so overwhelming, and I know it's overwhelming because I went through it. Like, I understand, and there's only so much that you can do,
Mm-hmm.
but as time goes on, you can do
Slowly,
better.
slowly change things, progress, and improve.
Yes.
So I love hearing that because, again, there's a whole lot of stuff. And I always say it's like a rabbit hole when you get onto Google about different things. So it sounds like you found a book that actually kind of guided the rabbit hole a little bit. And then you would pick up different things. And I agree. Like, I think that the water, like, if we're not addressing the water, and that's probably the most basic thing that we can do, but it is expensive for some. Like, we had implemented, I don't know if you, I'm sure you do at the office, the whole filtered and reverse osmosis system, just because I'm like we can't have the water like if we're doing a wellness, we can't not address the water while we're doing the wellness. And like if you're in getting an IV, I want you to have options to have, and so the staff as well. But anyhow, but I think these little things, we don't realize how much that we have in our products and how many toxins are actually in products in the US and are like basically not regulated and approved each year that aren't even present in other countries. And so I think that they did a study once for umbilical cord, and there were like 200, and the umbilical cord is meant to filter out everything from the mother to the baby, and there were like 256 toxins found in the umbilical cord blood. And so basically that filter isn't working when you are overloaded with toxins. And so you're saying, like, again, it's a whole life detox, not just in one aspect but in everything. And it, cosmetics, everything has artificial. But so when we talk about, like, so the two things also that I know that you did end up doing in addition to like the water and the HEPA filter, and you're talking about the HEPA filter in the house. And then, but so how we ended up together was the vitamin C, because again, as I built out the vitamin or the IV therapy, it was amazing to me what just the IV therapy could do. that we don't even address. And almost everything is, a basis of some kind of nutrient or vitamin deficiency in the body. And again, you're approaching it from a different way. If your liver is overtoxed, then you don't have those detox mechanisms in place either in the liver. So high dose vitamin C was one of them, and hyperbaric. You've been doing the entire time. So talk a little bit about those two.
Yeah, so again, we just randomly stumbled upon your office and the health food shop or the health store that's right next door. And then we learned about Trader Joe's in that same parking lot. So I feel like that's my healing parking lot. There's so many good things going on there. But yes, back to the vitamin C, and the way that we are approaching it is healing my body within. So the vitamin C to me it's not curing anything. Like, I acknowledge that, but what I need is my body to just kick it up a notch and start detoxing this cancer that I have that's overgrown, these bad cells that have set up shop in my liver and my colon. So let's get it out. And one of the ways is the high dose vitamin C, and even just vitamin bags in general, because of deficiencies in the body. So that we started coming in basically weekly, bi-weekly in the beginning, weekly, and still come in. So still trying to boost my immune system. And I have to remember, again, like, this didn't happen overnight. So the solution is not going to happen overnight either. I had a lot of toxicity in my body. So we can think, like, even though I took a different route, I was still sick, because you're sick when you put these toxins in your body. Your body will tell you, oh, I shouldn't have ate so much, or oh, I feel not like. That's your body telling you probably shouldn't have ate that. But a lot of the times we ignore it and go on. But it also, when it comes out, like, you're also hurting. So there is still a lot of pain that I had during this alternate journey that I took of detoxification, because it's got to come out somewhere. And you pee out some of it, you sweat out some of it, but, like, your body is still reabsorbing some of those toxins trying to come out of your body. So I was still sick, but I was still able to go do things. I was still able to travel down to Florida to see my family. I was still able to go places. So I'm not bedridden. I'm not bedbound.
Not vomiting.
Not yes. I am comfortable going into a store or going out in public or going somewhere. I'm not going to pass out, but I am sick, and I know that, and I keep that in the back of my head. Like, okay, this is going to hurt come out, and it did. And even though I did the vitamin C, the hyperbaric, I still had a lot of stomach issues, because my body's like, what are you doing? You've ate a certain way your whole life, and now you're giving me this green juice. What do I do with it? Or I'm drinking aloe because it's supposed to help with my digestive tract, and trying to get all of that moving. So all of those different changes and detoxification did make me sick. And I do remember laying on the couch, being so sick from one of the ozone treatments that I had. It usually kind of, for me, like, these initial therapies would shock my body. Like, okay, we're filtering this, we're adding oxygen, and so now I'm kind of like sick trying to get it out. But I remember laying on the couch one day. It's very sad. I was hurting just so bad. I was just crying, and I had an appointment to go for ozone therapy, and I was supposed to drive that day, and because my husband was helpful in taking me to some of my appointments when he was able to. But that day I had to go by myself, and I just remember laying on the couch and just crying and crying. And my husband come home. He's like, well, you're supposed to be on the road. And I told him, just let me die here. I am just in so much pain, and, like, I just don't feel good. And he was just, that was not an answer. So he helped me get up. And it wasn't that I physically couldn't walk. It wasn't that I physically was vomiting or anything. I just hurt. I hurt, but also mentally I was hurt too. And the mentality, or the mental aspect, the spiritual, the emotional journey also had to change. because I knew that I was sick and I thought that I was going to get better, but it's hard when you have everyone telling you, "Oh, you're going to die," or there's no way that you're going to survive liver cancer. And you can Google that. Like the research for liver cancer is the prognosis is not good, just like pancreatic cancer. So I had all of that negativity coming at me, and then in my head, I'm trying to think like, yes, I'm gonna make it. I'm gonna make it. I'm gonna do. I'm gonna do. I'm too young. Like God didn't put me on this earth for just 33 years, or did He? And I, it was also a mental battle.
It's a lot of emotional weight for sure. That's exhausting. But then you also did, and again, I think that breaking stuff down at some point into other areas, but I want to touch on some things that I know about your journey. And so, as you were doing this, obviously, there's times when that emotional heaviness or even the physical stuff is still coming out and you're detoxing, but you also still have, some lesions in the liver that at least you last had looked at. You have the sigmoid colon issue. I know you were doing all these detoxing things both from a lifestyle and some interventions, but also, were you still continuing to have pain? Did you ever get pain in the colon? And then I know there was a turning point at some point, just so people can understand that there was still a lesion in the colon and there was still some liver mets, and she's changing her lifestyle all the way around, reading, learning, and doing some interventions that are possible. And then what is happening during that time frame, and when did things change a little bit, because there was a big turn in the story, and like, again, I think like an outcome that is way beyond miraculous at this point. So
Yeah, so during the detoxification, like I was saying, I was still in pain, but I didn't. The liver pain started to go away, and so that what made me more hopeful in what I'm doing. The bleeding from the colon was still happening because I still had the colon tumor there, but that wasn't as significant as it was before.
so all good signs.
Yes, yes. So even though like I'm detoxing, I feel just sick in a way, and I don't really know how to describe the sick that I feel, because it isn't, I'm not actively throwing up. I'm not just staying on the bed. It's just like an overall just bleh feel. But as I'm going through that, like I do feel better. I do feel as if things are starting to get better. My body is trying to regenerate. It's trying to heal within. And so I had those diagnoses, those CT scans from MD Anderson in March. And then in June, so by that time, I was still doing these different therapies. In June, I had a PET scan, and the PET scan showed that I only had 3 liver spots, where before I had 5 liver spots. And it obviously I still had the colon tumor. But I remember the doctor walking in, so we had got the results before we looked at it, and we're like, I think there's only 3, and they call it out on the how they explain it in the report. So we're super excited because we went from 5 to 3 in just that short of period of time, from that true change of diet, water, toxicity removal in like February of 2023, now June 2023. Now I have 3. So that's
months later, yeah.
super exciting. And truly my blood work is very good. There wasn't really anything to call out other than like my glucose was low, but that's a different story, and how the cancer and glucose and insulin, all that work. But anyways, so we go in and we're excited. We're like, oh man, that oncologist, because I did establish an oncologist here at Tennessee in case I needed to have certain things done. The oncologist, we mutually agreed that I was not doing chemotherapy. So at this point in June, spiritually, it's led up to we are not doing chemotherapy. And he agreed to take me as a patient, even though I wasn't doing chemotherapy, but to help monitor my labs and the scans. I don't know, recommend hospice and palliative care when I get there, because, that's what they're expecting. And I understand that's all they know, possibly. But anyway, so we go in, we're excited. And he just walks in. He goes, yeah, your situation is getting worse. Or he says, yeah, your prognosis is still really bad. And we're like, what? And he's like, yeah, the PET scan came back and is showing this. I'm like, well, can you help us understand the imaging? Because we had read it different with the report plus seeing the scan. Can you help educate us on why you are telling me that my condition is getting worse? And so as we went through it, he kind of was surprised because he realized that it was 5 and now it's 3. And my blood work wasn't bad at all. And so he was actually a little surprised. And I even made kind of like a snarky comment like, well, are you surprised that it's gone from 5 to 3? And he did say yes. So, I mean, he acknowledges that, there's something else going on, and they don't know. I know, we know. And it wasn't something that I went in there saying like, we're doing all these different therapies. Like, we're paying for a service to come in and help me understand what the PET scan says, what the findings are, and like, what are your recommendations? Because I'd like to know, again, as an educational piece. And they referred me to palliative care and, different things ultimately, but we just kept going on, kept going to do vitamin C, kept doing ozone, hyperbaric, all of the clean eating, the clean drinking, removing the toxicity, just trying to learn how to meditate. Like, that is so hard. We don't stop in society. We just keep going, and we feel as if we have to keep going. And you don't. You can stop and sit and be quiet for a little bit. You don't have to be on your phone. Like, those are choices that we make. And when you're forced to make these decisions or these changes that I had because my life is on the line, then it's easier, quote unquote, easier to do. But if you can do them now, then you are better off because you're practicing that. You're,
Becoming
again,
habits.
better habits. Yes.
Developing all those habits. And so, but it's interesting because you never once heard anything about nutrition, fitness, meditation, balance, anything from our medical community.
No, and those are some of the questions we asked at MD Anderson as well, thinking, this is a top institute, you're treating cancer, you supposedly have better outcomes than other local hospitals. Well, how are you doing it? And we asked the liver doctor specifically, and my husband, who's a dietitian, went to school for nutrition, how the body basically heals or repairs with nutrition. The liver doctor said nutrition and cancer have no correlation. And in the waiting room for where the infusions take place, because it's a huge facility, so that's, we had to walk through there. They were offering cookies and candy and like hot chocolate to these patients. And it just broke my heart to see that, because we're telling folks that nutrition and cancer have nothing to do with each other, but that's not true. It just simply is not true. And why do I know that so wholeheartedly is in a PET scan, we use glucose as like that attaches to that radioisotope, I think, and you can probably explain this better, but that it's attached to it, and then your cancer uptakes that glucose, and that's why it highlights. So if we know that we use it in a scan to show that you have cancer, why wouldn't you just intaking that feed the cancer it's going for it?
So that was MD Anderson with the liver. So it's very interesting because, again, I think historically over time we've had starvation states as like our bodies and our cells are used to starvation states, and cancer cells aren't. right? And so even the high dose vitamin C, which again I learned about when I was building out our IV therapy and formulations, is it goes into the cell, forms hydrogen peroxide. This is high dose too. And again, I mean, we can get into this. This is, for a different day in podcast, because the high dose vitamin C will go into the cell, convert to hydrogen peroxide, and then we have an enzyme that can break it down, but cancer cells don't, which is why it could be beneficial to killing some cancer cells. So, usually used as an adjunct to something else or lifestyle interventions that you're doing. So, and decreasing inflammation, which happens with dietary stuff that we do. And again, I think across the board, sugar as a way of like that starvation state. So changing and kind of starving the cancer cells is one of the things, because again, our cells are used to that, but cancer cells are not. So I think that was a well established, I never learned it. We don't learn anything about nutrition in medical school. And so, but it's surprising that the leading cancer institutes are also doing the same thing. Like I've already seen it, the post surgical, like at smaller hospitals, and you get the same tray as everyone else when you're able to eat. But yeah, it's amazing and eye opening that you're sitting there watching, and where the chemotherapy is going down, we're actually giving them sugar, almost counteracting like the effects potentially, like at
Yes.
least theoretically, even if that wasn't the case, I mean, like if we were to prove that it was counteracting, maybe we need to prove that it is counteracting like both sides. So like again, um, I think that's huge that people need to know that sugar feeds cancer cells. And again, we can take a tumor out of your colon if they did it with the sigmoid, but then give you pudding right after. And so that makes zero sense. And so we've had this conversation. Renee and I have had this conversation multiple times. But also, then it got to the point where you literally, things were changing, because that's when we actually met. And so, what had happened right then, reapproaching the doctors, the resistance that you ran into, the blocks, and how that almost did abruptly, end your life. And then how you overcame that, I think, is huge. Even if we take some of that onto another, and deep dive into it, another, podcast, another episode of us just sitting down talking. But tell us a little bit about that, because you were like, again, I think we're June, July right now.
Mhm.
And then there were some changes that happened right after that.
Yeah, so June, I get the reevaluation of, okay, I have 3 liver spots now. I know I still have my colon, but what I'm doing is working. So it's working for me, and I'm excited. So I'm continuing to pursue clean eating, staying away from the oils and the sugar. And again, that's probably a whole different podcast to talk about, like what's good to eat and what to put in your body. But yeah, so I'm doing well. And during this whole time too, I have these spiritual interventions, I guess you could call it. And one of the other things that I haven't mentioned yet, but I did mention about the emotional healing and the spiritual healing. And I, of course, consistently prayed and asking for help, asking for guidance. And one of the things I read about colon cancer, from more of a maybe a spiritual perspective, is there's something at the root of your body or your core that's bothering you. Maybe that is you're not letting go of. And so when you stop and think, well, yeah, I'm sure there's probably a lot of things, but no, what truly are you not able to let go of? And the science behind that is the I think it's parasympathetic and sympathetic system, where you're in fight or flight mode. And when that happens, your body can't repair itself because it's always fighting things. You're probably better able to explain that than I am, but like that's kind of the short understanding that I had of that. So I prayed and prayed and prayed, and one of the things was I back in high school I had a fallout with my elementary best friend all through high school. something major happened, and I said I'd never talk to her again. I can't believe this happened, blah, blah, blah. She went and lived her life. I lived my life. But I prayed. I said, I didn't know about this. I said, God, what is at the core? What's something that's still bothering me that I can't let go of? And she appeared in my dreams twice. And I'm like, really? I thought I put that to rest, but I didn't, apparently. So again, not only once, but twice she appeared. So I reached out to her on Facebook. She had actually reached out to me in 2016. So you can see, like, my answer was to ignore her, but she wanted to reach out. So this was my opportunity to reach out, and I apologized to her. I apologized for myself, and I forgave myself. I think that's one of the bigger things in the emotional healing is forgiving yourself for what has happened. You can't change the past, but what has happened, even if it was out of your control or in your control, it's done. It's done. So how do you handle that going forward? How do you handle that currently? And so I reached out to her and told her what going through stage 4 cancer. One of the things is emotional healing. And I want to reach out and apologize. I forgive you. I forgive me. And I hope you understand. And, she wanted to actually meet up with me. So in August, so June, I get that. I have 3 liver lesions. So in August, we plan a trip. I go see her down in Fort Lauderdale. And it was just like reconnecting with your best friend from high school or elementary. And I can't explain, but there is such a relief that came off of me when I sent that message to her. And I just felt good. And so we went down. It wasn't awkward. It was a great experience. And we're reconnecting as best friends again to this day. But so I'm well enough in August to go down to Florida, and we go to the beach, we go to different parks, walk around, go outside, and kind of live what they're living and catching up on, I don't know, 15, 16 years of not talking. And so come back. So this is about September. I start a new therapy. I can't remember which one. Digestive enzymes. And I kind of get the flu. I kind of feel like I'm getting the flu. That's my body detoxing again, is the headache. Just feeling bad, maybe low grade fever. Your body is trying to fight something. And I kind of feel like in September to October's starting to like decline a little bit, but I'm not feeling my liver cancer. I'm not feeling that pain. I just don't feel good. But I get better in September, so I start doing better. And then October, I get truly some type of virus or something. And I'm in bed, like trying to sleep a lot. I'm not eating as much, but I'm trying to recover from this. And I have these really high grade fevers. I'm talking like 103, 104 temperature. And what would happen is I would have a fever, and then I would sweat, and then like get chills or whatever order, I can't remember. And that happened for almost 3 weeks, which is concerning. Like now, okay, maybe I do need medical intervention with something like this versus I'm going to get over this virus or this cold or the stomach bug or whatever. So I just like continue to progressively get worse, but it almost seems like, this sounds bad, but like I may have caused it myself by not moving a lot. I laid in bed a lot because I felt so bad. I didn't eat a lot. So all of those things, I think, changed the motility of like my digestive system. I'm not eating, so it's not moving as much. And I get to the point where I'm pretty sick. And we're talking and like, what do we think is wrong? And come to find out, like, I'm not able to pass stool at this point. And now it's like serious. Like, okay, we know we make jokes like, oh yeah, I haven't pooped for 3 days. Well, like, this is a serious issue at this point now. And this is where I am feeling a lot of pain, not from my liver again, but whatever is happening in my stomach
Mhm.
is awful, like 8 out of 10 pain all
I
the time.
think this is when we ended up at some point. It might have been, well, it was throughout this like few week period because I think you were in, then Erin was like, there's a little bit, we did blood
Hmm.
work, the pain was progressive. Like, and again, you were doing still like a new therapy. Maybe that was it.
Hmm.
Maybe it's, so there was, we were sorting through it as much as we could as an outpatient, but things were changing. I think you got a little more anemic too, which, again, prompted maybe a scan just to look at it. And so, because it was a pain that you hadn't had before and a little fever with it, and it did go on for a while. And so finally you did end up having a scan that showed.
Yes. So at this point, I call the oncologist. I'm like, I'm not able to pass stool. I am hurting really bad. Is there any way that I could get a CT scan to see what's going on? Because again, at this point, I was doing well. My liver lesions are healing. And so they allow me to get a scan. I get a scan, I think that day or maybe the next day, because of the symptoms that I'm complaining about. And I get the scan at an outpatient place. The oncology gets the results, and I call them and ask what the results are, and they tell me I need to go to the emergency room immediately. I have a possible bowel blockage. So I'm like, okay, all right. Like, okay, let's go to the emergency room. And this is at UT. So the way that I understood on the phone is like they were going to call the emergency room or whoever. I'm coming. Let's get her a room. Like, we know what's going on, at least from the CT scan. So let's get her in there and get some more scans or blood work and see what's going on. So I go to the emergency room and they don't know what I'm talking about. They've never heard my name. So they're like, okay, well, like basically take a number and sit down. We'll call you when we can. I'm like looking around, and there's so many people. There's 93 people in front of me at the emergency room, and there's people coming in through ambulances that are probably having heart attacks. So yes, they're going to skip the line. I understand you're having a heart attack or some other issues. So I sit there for hours. I don't remember, maybe 8 hours before even being seen. So I'm in pain. I just got told, like, I probably have a bowel blockage. We don't really know what that means, but come to find out, it's you can die very quickly with this.
Mhm.
And so we're just sitting there waiting. They do all these scans again, and finally get a room in the ER room and have surgeons come in to talk to me about what's going on. So they tell me I'm laying in the bed, I'm getting fluids because I wasn't drinking because I thought maybe I was going to have surgery if there's bowel
Mhm.
blockage. It's almost like, okay, bowel blockage. This is the protocol that we do for a bowel blockage. See where it is. What do we have to take out? And then go on. So I wasn't eating and drinking. They're giving me IV fluids. Surgeon comes in and looks at the report and asks, "Are you doing chemotherapy?" And I'm like, well, "Why? No, but I'm not." And they're like, "Okay, well, you have a bowel blockage, and it looks like your colon tumor is blocking your bowels, and so." Because you have chosen not to do chemo, here are your options. And they said they could do a diversion, which my understanding at the hospital was basically they would leave in the blockage. They would put basically a temporary ostomy in, and then basically they explained that your colon would rot and eventually you would die in probably, I don't know, a month or two. Or we could do nothing. That was another option. Um, but they never gave the option of taking the blockage out. And so my husband specifically asked the question, if she had done chemotherapy, would she have different options than what you're presenting to her today? surgeon looked at us directly in the eyes and said, yes, you would have different options. And the way that he explained it is because I chose not to do chemo, they said that that was me choosing to die. Therefore, there was no obligation to save my life, like long term.
And that conversation had happened too, that last part of it, like where you chose not to. Because I know that they had denied surgery and
Mm-hmm.
again, that you guys had asked, but he also said by choosing not to
Mm-hmm.
do it, that
Yes.
you chose to die
Yes.
and they are not responsible for saving your life
Yes.
at the same.
And in my medical records, like when I talked to oncologists, when I established that, I told him God came to me and said, do not do chemo. And I had different dreams, which we haven't talked about yet, but I had different dreams that led up to continuing this path. Like I'm on the right path. And I'm pretty sure that's in my record because I let him know, like, spiritually, this is a choice of freedom of religion. This is my choice by God that I am going this route. And so the idea that they were denying services, even based on my religious belief, was just sad. I was very sad. And also sad that they were literally sent me home on hospice because I wasn't doing a diversion. That I'm ultimately going to die with that anyway. Why would I do it? Quality of life. Let's go back to quality of life conversation.
So I'm kind of confused at why they would actually open you up to a surgery but not remove the tumor and just divert it. So again, options that I think are unacceptable and were unacceptable to you too. But again, not everyone has like also another path. And some people would go home and do exactly that. And again, there are lots of decisions made for religious reasons. I don't even think you need a religious reason to make a decision about your body. That again, if there's a blockage, removal of that for acute intervention is quite a bit different, and whether that still continued to grow back or you didn't heal from it or your liver mets, worsened, that is again your choice and outcome and you're willing to deal with that. But the acute intervention was what you were asking for. And so again, you guys chose a different route and were fortunate enough to have some very again, miraculous things happen during that. And that is again what just happened and what we had already talked about and what we just heard is absolutely unacceptable from a medical standpoint. And but what happened next is again was meant to be.
Yes, it's even more, like you said, miraculous. And I kind of keep throwing out, the spiritual
Spiritual.
journey that I continue to have in this, and how God comes to us in dreams and things happen for a reason. How did I just stumble upon Revitalize MD? How did I just stumble upon this book at McKay's, or someone sending this information, talking to someone randomly at a grocery store, sharing their experience that ended up being added to my intakes? Like, all of these for me is not coincidental. I truly believe in higher power, and God's come to us to help guide us. And also, just I'll throw out there, even before this happened, right before, my dad did came up from Florida to visit me because I was feeling sick. And I was baptized during that time frame. I was still very sick, but I was very excited to really just not prove, but show everyone, like, I am committed to Christ and faith and led by God, and this is how I'm doing it. So that happened, and then literally a week later, this UT experience happened with the emergency room, go home to die. So we go home and we're thinking, again, we are trying to think through, like, what are our options and stuff like that. And my husband's cousin texted us randomly and said, "Hey, I haven't talked to you guys in a long time. How are you doing?" And we're just like, "Oh, I can't believe he reached out at this time where literally I probably have 2 weeks to live." And that's what they said in at UT at that point, because eventually your bowel would do a complete blockage and perforate and all this other stuff. So he texted, and my
No,
husband,
no coincidences in life,
yes.
right? Yeah.
And so he texted, and my husband talked to him and was telling him the situation, and we sent him medical records and had the so he works at Cleveland Clinic, and was did surgeries with the colorectal director up there, different colorectal surgeons and liver surgeons. So we sent him medical information to say, look, is there anything that you can do? Anything, like you said, the acute piece. Let's see if there's anything. And all that he said was, I think he can do something. So we go home, and I'm very sick at this point. I actually look like death. Like, I'm white. I have no color. I have no appetite. I just don't know what to do. And I'm just hurting all over. And so we get in the car, and we have to make a bed in the back of the seat because I cannot sit down. I'm hurting so bad. I literally can't sit. So I lay down, and it's a 10-hour drive to Cleveland. So we drive all the way up there, and end up having emergency surgery because they see that this is an emergency situation, and I have a huge mass that is blocking my bowel. And they, from the CT scan, they saw that there's some type of fluid possible buildup, and so they don't know what's going on. But the surgeon comes in and says, we'll try to remove your blockage laparoscopically, because it truly was a blockage. It wasn't necessarily the cancer tumor, it was a blockage. So they go in, he comes in and says, I think we'll do it laparoscopically. If not, we're going to have to basically slice you down and try to see what's going on. So I get rushed into emergency surgery. It takes about 2.5, 3 hours back there, and they come out. Of course, I don't know what's going on, but the result was you had a huge blockage in your transverse colon. Somehow, like, your sigmoid merged or did something to the transverse. So like the way that your colon is, it kind of does a U and then does an S. So somehow, like, the S part started to merge with the U part, and I don't know all of the dynamics there, but they ended up having to take 31 inches of my colon out. And they also found that I had this cyst in my body. So he said that my bowels have perforated. And so my understanding of that is kind of like basically toxin leakage into your system that kills people when you have bowel perforations. And mine had perforated. But my body created this cyst that somehow all of that fluid or that perforation went into. And so the doctor's like, I'd never seen this before. So they had to, they removed that as well as the full blockage. They put a ostomy, a colostomy or ostomy for me. And then just, I had to, I was in the hospital after that.
Yeah, I mean, you were in the hospital for a little while,
Mm-hmm.
but again, you would expect that
Mm-hmm.
because it went on for a while.
Mm-hmm.
And again, perforation, you're right. So what happens is it's obstructed, things are going to try and get through, and eventually it's going to get so distended in an area that it perforates the bowel open. And that's our waste system, right? Everything in our bowel is going out. We're eliminating. And so now all of a sudden it is going to be within an area that should not have, the waste of our GI tract. But yours actually sealed off. And again, a miraculous finding. You make it to a surgeon in time, they do the right thing, the right path happens. It's a rocky recovery, but you do recover and are able to go home finally. And now you're no longer in Cleveland, you're in Knoxville. But how do you feel right now? Like, do you have any ongoing pain anywhere? I know, of course, you did after surgery for a little while,
Right.
but
So after surgery, and then I'm in the hospital for a week or so recovering because again
mm,
they slipped me down from belly button down, and just for folks that don't understand like what kind of surgery that is, I mean I don't remember how many staples that they stapled me through, but anyways they did all that, and I was recovering well. Talked to the surgeon, and he said, if you didn't get in here at the time you did, you only had literally about 2 days to live. Like that's how close to death I was. And so like today I just think about how grateful I am, like grateful for them to give me the opportunity to live, because that's where the medical system saved my life. They really did. I mean, there's no amount of coffee enemas that would get rid of that blockage. There's no amount of supplements I could take that at this point in time where I am would have just cured it, and they were able to save my life. So I'm so grateful that they gave that opportunity to me. And again, like coincidental or faith, whichever path that other
mm-hmm,
folks believe in, for me, that was a divine intervention, that God gave me a second chance at life. And now what do I want to do with it? What can I do with it? And I pray every day, like, what am I supposed to use this for? Like, this is something that, I shouldn't be here, but I am here. God gave me a second chance at life. I'm feeling better. Yeah, it's something to get used to with having a ostomy, and um, but I don't have the liver pain as much. And ironically, or coincidentally, or there's no coincidence, in the CT scan that Cleveland Clinic did, oh no, excuse me, that UT did, they put on the report even that the right side of my liver didn't show any cancer anymore, and they thought that like I was doing chemotherapy treatment but wasn't telling them. So the CT scan in November showed that the right side of my liver had healed. It calcified. There wasn't cancer that they could see through that CT scan. And then they did another CT scan at Cleveland Clinic, and the left side ended up having more cancer, but it kind of makes sense because all of that happened on my left side. So it was like kind of filtering
mm-hmm.
through all of that. So now I have one cancer spot, but again, still metastasized in stage 4, but I have the one cancer spot instead of all of my right side that MD Anderson wanted to completely take out. But through these different therapies, this journey, um, through God, like I was able to heal that side of my liver and still have it, and still have my gallbladder, and still have my xiphoid process, all of that I wasn't going to have if I chose a different route that MD Anderson recommended.
And no longer have that source tumor,
Mm-hmm.
again, that big, huge tumor that could still feed. And obviously, you know, and anytime it is metastasizing, you have something like little soldiers in the body, is what I would always say, that could be somewhere, right? But it's better than having a continued army right there, And so now all the lifestyle, changes and interventions and detox, is just from a new starting point, without
Yes.
that primary source. And so I think you've always been very realistic about, even as you say, well, it's still stage 4, there's still mets, like very realistic, but also very inspiring because it's your journey, your body. You just chose a different path. I think pointing out that the medical system can fail, but when we need it, that's the point, is like doing surgery is when you absolutely need surgery. Meds and surgery are there as great options. But if there's other options that can be tried, That's a personal choice. And still, we should not deny anyone that freedom of choice, to pursue it. So I think, honestly, from my perspective and just knowing you and talking to you so often, and then even just hearing it again, that I think doing like this would resonate with so many people and inspire them to at least empower them to make other not make other decisions, add decisions. Like, and nutrition is such a huge part of it. And there's so many other things that they can do, even if they're undergoing chemo, if their choice is to do chemo and surgery. But to ask the prognosis, because if they're going to take out a lot of stuff and large incisions and you already don't feel well, what are the chances that you're going to actually recover from that? Or is there something else I can do while I'm doing some treatments that would help? So I think doing ongoing videos, for that resonation with, the people that really need to hear that there's ways, that you can take power back, and this can be a joint journey between medicine and between the patient, for the desired outcome. So,
Yes, and I think a few quotes that I've read or heard that's really important to me, and I still think about it every day. You can believe the diagnosis, but not the prognosis, because you can be in control of that. There's certain things that, yeah, prognosis, there's probably a cut and dry, this happens in a few weeks, this would happen. Like, I understand that, but for me and my journey, the 2 months back in March of 2023 was a prognosis, and I didn't believe it. I truly did not believe, like, I only had 2 months to live, and I just kept going and going. Is it difficult to think and really believe that you will get over this when you're going through this? Because I will tell you, through the sickness, the feeling good, even the healing, some of those emotional journeys, like, still in my head, I kind of felt like, man, all of the odds are stacked against me. Like, I got family that's like, you really should do it this way. So then I feel like maybe, it's not that, like, my dad wants the best for me. I understand that. And he's just trying to help suggest what he thinks is right. But like, I am being a trailblazer in my family and other people that I talk to about taking an alternate path of healing, and not curing, because, like, ultimately you read some more books and you read everyone has cancer, and how your body handles that is whether or not you get tumors or have, bloodborne cancer. And there's different theories on that. We could talk about that in a different segment. But so it's almost like I had all of this against me. And like, in my head, I was thinking, okay, I will get through it, or will I get through it? I don't know. I don't, yes, no, yes, no. But when I let go of the fear of death, because that was what I was scared of. When you get diagnosed, you're going to die. You're scared. Like, I don't want to die. I'm 33. Like, I don't want to die. But I got over that. And my religion helped me with that. If God only wanted me on this earth 33 years, then I need to accept that and do what I can while I'm still here. And once I got over that fear of death, other people didn't scare me. Like, the doctors telling me this, or family telling me this, losing friendship over the decision that I'm making because someone felt so strongly about a different path that they wanted me to go on. Like, I let it all go. And that fear subsided, and it frees you. It really makes you free, because again, you're in control and you can help the situation the way you want to. But it's hard. And the turning point was the bowel blockage, and knowing that I had 2 days to live. And I just remember my dad saying, you did it. Like, this is it. You're going to survive now. And just someone saying that to you, and then, I'm hearing it from the doctors too, like, that change of perspective from them also helps shape my perspective. And now I do have a more positive outlook. I still was positive during this journey, but it was an uphill battle. And now I feel like I'm on the downhill with all of the pain and the suffering and like the emotional traumas and all of that stuff. But like now my mentality is in such a better place after that bowel blockage. I'm more grateful, I'm more spiritual, I'm more forgiving and understanding, and I'm want to give people grace and like not judge people, because that's not what I do. That's what a higher being in my religion, that they do that, not me. So letting all of that go, my mentality is better, my emotional health is better, and I continue to work on that every day, because this isn't okay, this is done. Like I said before, now I'm going to go back to like
Yeah,
some of my
yeah.
old habits, trying to get rid of stress. We're all stressed, we all have to go. A lot of people have kids, they have grandparents, the parents are taking care of, all of that is stressful. But you have to take time for you, because when this happens to you, like your life obviously changes, but then you also start to reflect back. Why am I here? What am I doing? Am I living my life for someone else, or am I living my life for me or for my religion? I'm living it for God. And what am I supposed to help people do with this or this information? So like I've found a larger purpose in this whole thing. It's not working for $1 billion company helping them make millions of dollars. It's helping individuals and the impact that I can help others, and not make decisions for them, but at least educate them in, hey, there's different options. Let me tell you what's worked for me, what may work for you, or some of the questions to at least ask, so you're comfortable with the decision that you will have to ultimately make that will affect your life.
Girl, like I think that there's your answer right there. Like a book that, creating different paths for people to, like, even if it's personal coaching if people want, because sometimes it's just a matter of being an advocate for another patient, but also a book, blogs, videos. Like there's so many people that need to hear your story, and you're an inspiration to us all. So we are definitely going to sit back down again and talk. We not just in the office, but in front of videos or in front of the camera, because I think that what you just said over, a course of us doing this podcast is something that others need to hear. And so if it's in written form, if it's in, again, video, but people want to hear, and even if it's coaching, I think that those are all different options, but we're going to talk more about that. But for right now, we'll wrap it up for today. But I want to thank you so much, Renee, for being on the podcast and sharing your story. And again, I want to dive into different aspects of that. But also, I think we all need accountability coaches too. So I might give you a couple things that I want to be held accountable for, and you need to make sure that I continue to do them. And it's usually discipline or habits. And then I might do the same for you, and just, kind of nudging you to do some book writing, or more videos, all of the things. So, but thank you so much for being on. I so appreciate it. And again, this is something that we could probably talk for another 6 hours on, and then resume the next day, because, we do tend to just flow and I hear more and more each time. So thank you for sharing with everyone else.
And thank you for the opportunity to, I don't know, spread at least folks to hear my journey and know that there can be hope found. For me, it was very spiritual. I'm very happy that it sounds weird, but I'm happy that I went through this, because I am a better person. I'm in a better spot, and I have more opportunities to help people. And that's what I love to do, is help people. I want to help, whether it's heal them or just give them information, empower them, know that you're in control. It's so important. But I do want to thank my husband for being there by my side like the whole time. And
Oh, yeah.
it's that, again, that could almost be another segment, is because I'm telling you from my perspective, but from his perspective, like the taking the caregiver perspective, like you may not be going through this, but you may be a caregiver to someone going through this. So, what can you do to help? We hear, well, you could let me know if you need anything, but what are some things that you can do? And my
Mm-hmm.
husband was there the whole time and helping me through this, and I wouldn't have gotten through it without him. Like I said, on the couch, like I was done, but he had faith and kept going with me, and he's still there with me every day, and he wouldn't change anything that we've done.
So nothing happens out of coincidence, right? You know that. And so again, I look at this as it happened for a reason, and it's because of your strength and ability to inspire others. So I look at this podcast as just a door that you just went through, because again, I think that it was something you struggled with, sitting and telling your story, and so it's been months, that we've been talking about this, but now you've done it. So now it's going to be time to write, and do more videos and, resonate and connect with more people. So
Thank you.
thank you. And we will do this again very soon, but thank you for being on today.